why I stayed in the industry, because I noticed how big impact it actually has on patient outcomes. And I know that we like to vilify the industry, and sometimes maybe for very good reasons. But I think without a big private pharmaceutical, biotech, and medical device industry, we would be still in the 19th century.
Hi, everyone, and welcome to Season 5 of Stand Up and Stand Out. Can you believe it? Already to Season 5? It has been a whirlwind year already. A lot has happened. You guys know after listening to Season 4 that I just launched Chameleon Mindset, my new book about how to embrace change and build mental resilience to transform your life and career. Lots more information obviously coming on Chameleon Mindset. We'll have the new online course coming soon. We've been doing lots of webinars, and I'll be on the road for the book tour. So hopefully you'll get to catch up together soon. Because why not just do another one? I have another book that just came out, The Great LeadHERship Awakening. In this book, I collaborated with 20 other amazing women. Each of them contributed a chapter talking about when their leadership was awakened and part of their transformation, maybe over the pandemic or maybe over a longer period of time, really stepping into their power and showing what it means to truly be a leader. Hello, everyone, and welcome to Season 5 of Stand Up and Stand Out. I'm so excited for this season as we do things a little bit differently, as usual, being chameleon and adapting with the times. We've just finished launching the Great LeadHERship Awakening. And so for this season, we are interviewing all of the wonderful authors to give a little bit of a behind the scenes on their life. And so today is Kasia. Hi, Kasia. Say hi to everybody.
Hi. Hello, everyone.
So if you guys are looking in your book, in chapter 14 is Kasia's chapter. It is Sciencepreneur Academy, born during the pandemic. And in her chapter, she explores what led her to abandoning a successful corporate career, founding the Sciencepreneur Academy, which partners with life science executives to build world-leading brands and help millions of patients. I love it. It's a great chapter, and I can't wait to learn more about you and about all the exciting things you've done in your life.
Thank you. Thank you very much for the invitation, Nikki. It's really a pleasure to be on your podcast, and I'm looking forward to our conversation. So maybe I will start from saying that I'm a doctor. I'm also Polish, so I did my MD in Poland, and I did my residency in psychiatry in Poland, where I also worked as a psychiatrist, clinical psychiatrist for a couple of years. And then I made my first change in the career of a young physician because I joined the industry. I joined the pharmaceutical company and stayed with the pharmaceutical and medical device industry for 30 years. You may ask what really prompted a young physician to join the industry. You know, the quick answer is I was a little bit disappointed with how healthcare was not developing in Poland into becoming truly modern and helping patients more than it did. But why I stayed in the industry, because I noticed how big impact it actually has on patient outcomes. And I know that we like to vilify the industry, and sometimes maybe for very good reasons. But I think without a big private pharmaceutical, biotech, and medical device industry, we would be still in the 19th century as, healthcare and medicine is concerned. So I stayed because I saw a massive impact that the new treatments and vaccines and new medical devices had on the disease course and prevention of diseases and the mortality. When you think about mortality, that it increased by about 20 years over the last decades. I think this is all related to the progress in medicine, and pharmaceutical and medical device industry is a big part of it. So I stayed for about 30 years with all the pluses and minuses of working for the corporate world. And I think I've made the second major pivot during the pandemic. So what happened during the pandemic was, first of all, I got a total burnout from having like 3 jobs that I couldn't possibly manage. But what also the 2 things became very clear. One was the massive inequality in our healthcare system. Just looking at the data of COVID morbidity and mortality, even the early analysis in 2020 of some studies show that African Americans were dying 3 times as often as Caucasians. with Latino Americans being close behind African Americans. So this is something that we knew about always, and we really didn't do enough to remedy the situation. And then during COVID, we just saw the results of years of neglect. I thought that it just cannot continue like that. And then there was the second realization that the innovations that saved us, and I'm thinking about COVID vaccination and some drugs, most of them actually were developed by startup companies. So yes, we need big companies to develop the drugs, to bring them to the market, to commercialize them. But most of the truly breakthrough innovative thinking is actually happening in startups. And this made me thinking that I really want to be closer where this innovation happens and then help these startups to be more successful. And my 30 years of experience in big companies can actually help to make smaller companies more successful. So that was my second pivot. And this is what really led directly to setting up the Sciencepreneurs Academy.
I love it. It's such a great story. And this is where so many of us are using those things we've learned, right? It's like, it's not that, everything in the corporate life is terrible, and we've learned a lot, and we were able to learn a lot because they were so big, because they have economies of scale, because you're surrounded by lots of other smart people. But taking that knowledge and then helping other startups, start to really learn things more quickly than they would if they were trying to stumble through it themselves. And in your chapter, you really talk about how, they're kind of good at one part of the whole process, but there's so many pieces that they need to string together to really make a marketable product that, is usable and helps the end customer that they're trying to meet, right? That's amazing. Yeah. And I love the Sciencepreneurs. So I love your definition too. Smart and dedicated scientists, healthcare professionals, engineers, and marketers in the life science industry. It's such a cool combination of, and really visualizes what it is. We have so many different types of entrepreneurs now. Before we always had sort of, mom and pop shops, laundromat, restaurants, those kinds of things. But now entrepreneurs are so many new things in the startup world, bringing in technology and a combination of other things. So that's really cool. So one of the things you talk about too is that, focusing on the equitable distribution of healthcare and making sure these things really get to the people that need. And I think this is so important. So maybe talk about, why that's so important to you and how you've helped that cause.
I think that fairness was always important to me. And I think that's really coming from the point of view of fairness. I mean, there's absolutely no reason why some groups of people should get lesser healthcare than other groups of people. And I think in the US, we don't treat healthcare as a human right. We treat it as a benefit. I would like us to change that point of view, because I really believe that healthcare, equal access to healthcare, should really be treated as a human right. I know that it's completely unrealistic to expect that, for example, people living in very poor countries will get the same access to healthcare as people living in very rich countries. I'd like this to happen one day, but we probably are far away from that. But within a country that has one of the best healthcare in the world from the innovation perspective, which is US, but also the inequalities are the highest in the developed world, I think that it really undermines our ability to have a healthy population. And a healthy population builds wealth as well. So I think that we are kind of undermining our GDP to a degree by not really having the equal distribution of healthcare as we could in a highly developed country like US. Then there is the second reason, which is much more personal. And this is, I am married to an African-American man. And really looking at people who are my family and, people who I love dying in such a, big numbers than the rest of us, it was just excruciating.
It's just not fair.
Sorry.
No, that's perfect. And it's really emotional. It is, and it should be for all of us. And I have another friend, actually, I'm going to introduce you to her because she just had a book come out about crushing medical debt. And she's a doctor as well, but really helping people, one, better understand their medical benefits. And I think for too long, again, we've allowed insurance companies and a lot of waste to be in the system, which isn't necessary to be there. There's a lot of, false news about that. Well, everybody's suing everybody or suing the hospitals and malpractice and things like that. But it's much more basic than that. And just like you are doing with the startups to get the actual technology out there, it is possible for us to fix the distribution and the cost and make it more democratized for everybody to equitably have the healthcare. So I think it's incredibly important and love to help and support that in any way I can with you.
Thank you. And I think also that it's not a given that what a startup develops will be distributed, equitably. So needs to be an additional step taken between the development of the innovation, making sure that it's launched, but then that it's launched equitably. I think the best way to make it equitable, in my opinion, is to really make it accessible. And accessibility is related to, making sure that the payers pay for it, so that the right data, making sure that it's paid for. Or if it's meant for people who don't have insurance, some innovations are very suitable for people who may not have the best insurance or don't have insurance, that then they are really distributed in a proper way so that people have access to it, and then it's not too expensive for them to have access to it.
Through the process that you work with these Sciencepreneurs, you said you have a framework called DIVE. Maybe do you want to touch on that a little bit about how you help people? Having worked in tech for many years, I know I have a lot of tech followers who may be interested in this framework to help get their startups, whether science not or it may be helpful.
I just try to make it as simple as understandable as possible, because what I find sometimes is that when we tell Sciencepreneurs that they need to learn how to commercialize, it's a little bit off-putting because we use a lot of marketing lingo and language that they may not understand, and try to make it, I think, more complicated than it really is. So I basically divided what I believe every Sciencepreneur has to learn into 4 areas, which I believe are rather logical. And one is discovery, and discovery is about the market. So you really need to discover a lot of things about customers, the market, the unmet need. And I am teaching them how to do it in a systematic way. It's not that you speak with a few potential customers and you can develop the product based on a few interviews. Although obviously interviews with customers are important. So I think the discovery piece is really how to find out things. And I encourage them to use the same scientific methodology as they use in science to discover the market. It's through observation, through trial and error. It's through forming hypotheses and testing them. So there's a very, very similar scientific method of thinking when they want to discover kind of the world around them and how their product can fit and help. So this is discovery phase. The I is for innovation. And innovation is how you build a product that is unique. Because Me Too products do not usually get a lot of traction. And yes, we can have a Me Too product which is simply less expensive, but that's probably the only situation when you can get traction. Otherwise, we live in an innovative world and we need to innovate, we need to be unique, and we also need to do it without spending tons of money unnecessarily. So I'm teaching them how to develop an innovative product, also how to make sure that during product development they gather the right data, not only to satisfy the regulators, because I think everyone knows that they need to get regulatory clearance or approval, but how to satisfy payers, how to satisfy clinicians, what to do to satisfy patients. So that's the innovation piece. Then the value piece is a classical marketing strategy, how to increase the value of your product in the market. And I think this is it is really the marketing strategy or the launch strategy. And finally, the E is for execution. And this is the area of how do you execute your strategy? Not only during launch, but very early on, because the execution of the strategy starts very early. What kind of trials you implement? What kind of communication strategy you implement with the venture capital that will be funding you? And finally, what is your launch strategy and how do you execute that? And then as a follow-up, what is your life cycle strategy? And this includes also scaling up the company and building capabilities, because at each stage, you need different capabilities. So this is a nutshell dive, and I encourage all Sciencepreneurs to dive with me because I'm making it less risky for them.
And it's perfect because, I spend a lot of time in tech helping people do go-to-market strategy, make sure their pricing and analysis matched and everything. So I understand that challenge of sometimes the technical mind is really embedded in the way, they're building the product, but they're missing, sort of that well-roundedness that it takes to go to market. So I love that you take, the scientific approach to also help them use something, a skill that they have and just adapt it in a new way to get that product to market. So it's brilliant. I love it. Hi, everyone. My name is Nikki Green, and I am a life and business resiliency expert. I have been helping people for over 2 decades overcome their challenges and achieve their life and business goals. I wrote Chameleon Mindset for others seeking clarity while acclimating to new situations. This entertaining yet research-based guide to transitions will open your mind to unique strategies for finding purpose and achieving your goals. Through my new book, you will create the happy life you desire with 5 philosophies for change, beginning with C for creative adaptability. Move from resistance to resilience by assessing and adjusting your risk tolerance. The practical lessons in Chameleon Mindset will help you shift your mindset, sharpen your skill set, and overcome the things holding you back from dealing with change. We'll have the new online course coming soon. There are half a dozen modules in total, but the way you choose to pursue your destiny, it's up to you. Each module can be done independently or repeated as necessary to tackle new obstacles and new goals in your life. And you can earn extra Chameleon coins for uncovering them. What are Chameleon coins, you might ask? These are reward XP that you can earn to purchase additional Chameleon Mindset benefits as you progress through the course. You can get swag, group coaching, one-on-one coaching, exclusive event tickets, and networking opportunities. And if you collect enough coins, you can even earn a full-day VIP intensive with me to work solely on your goals. And by joining the Chameleon crew, you will also gain access to my network of thousands of influential people around the world with expertise to help you on your business, your personal endeavors, health and fitness, and so much more. Reserve a copy today and click below to be added to our subscriber list. Well, science wasn't one of my top skills, but I did love always traveling and speaking languages. And one of the things that I also noted in your book, which is where we have a similarity, is that during your business trips that you visited more than 50 countries and really got to know people of all sorts of different faiths and ethnicities. And I'd just love to hear, what was maybe one of your top 1 or 2 countries that you ever visited during your travels?
There are a few countries that I really enjoyed, that I really liked. And maybe also because I had a better chance to get to know them. I was there very frequently. Or maybe because they just have things that I truly enjoy. And maybe I'll start with Singapore. I love Singapore. Incredibly diverse hub for the entire region. Fantastic food, great culture, lots of art in the public spaces, in addition to obviously high skyscrapers. A little bit of history. I don't think there is, it's kind of hidden between these skyscrapers here and there. But there are a few really beautiful museums. There's a fantastic botanical garden and amazing food. And I think you really meet people from, almost all countries in the world in Singapore. 50% of the population are expats. So you not only meet locals, but you also meet a lot of expats. So I think that my meetings in Singapore are probably the most diverse that I've ever had. And I always enjoyed coming back.
Singapore was probably the place I went to the most as well. And it's great now when I go back because I have friends there when I go to visit and I go do the local experience. And you get past sort of, the shiny skyscrapers and going to work meetings. But you see so much more behind the scenes as you travel more. And then you really get to know the culture and the people there. So what other top favorites do you have travel?
In Europe, Portugal. I think that, I was lucky to travel to Portugal. In one of my jobs, I was in charge of Europe, Middle East and Africa when I worked at Merck. And I traveled to Portugal a lot because it was one of the top countries for this particular group of products that I was responsible for. I usually stayed outside of Lisbon in Sintra. In the same hotel, which had a view of the ocean. So I used to sit on the balcony with the view of the ocean in front of me and just, working on my emails and some work stuff. But also the level of hospitality, the quality of food, the history behind now Portugal may seem like a small country. It used to be one of the major empires in Europe. Maybe not very, criticize now the colonization that it did, but it was a major empire, and it shows. It shows in the size of its churches and monasteries and castles. I think this, in a little sleepy and agricultural countryside, is a interesting reflection of where You may have been an empire, now you are just a very nice tourist destination. So how the history, changed over time and made the country something else. But it's fantastic, and I love it. I love it.
That's amazing. My friend's actually doing a trek through Portugal this summer, so I'm very jealous. I want to join her for it. It sounds amazing.
It's a good way to visit Portugal, I think.
It absolutely is. Oh, yeah, just love it. And I think it's such an important part for all of us, to continue to better understand each other. And as things are now open up, to really continue to be able to travel, even domestically, even, in places that, are nearby that you just don't know much about, right? And the more you can really connect and genuinely get to know people, the culture, the food, the religion, whatever things that are going on in that community, I think it helps us do our jobs better. It helps us better connect as people. And you never know what exciting adventure awaits.
There are many more countries that I did not have a chance to mention. So I apologize to all my friends and others from those other countries. But whatever country you are from, and if I visited it, I probably liked it. I don't remember that I did not like a country.
I love it. We're going to do a whole travel series after this. We're going to make a new podcast. It'll just be me and you talking about
Just be talking about countries.
I'm in. I
like that.
This is wonderful. It's been great getting to know you. Time flies when we're having fun. But before we head off, is there any other kind of parting thoughts, things that you would like to share with the audience, or ways people can get a hold of you if they are a Sciencepreneur and they'd like to have you help with their startup idea?
So please connect with me on LinkedIn. I think that's my major platform. I think all of us Sciencepreneurs are there. So it's probably the best place to connect. And, let's talk. If I cannot help you, I can point you into the right direction. So just talking and getting to know each other is already a big plus.
There you go. Step one. All right. Well, we'll put that in the show notes so that folks can find the links. Thank you so much for joining us today. Thank you for being a part of this book. It's been wonderful to meet you in person, and hopefully we'll have another party again soon. We'll find another way to connect. Thanks everyone for joining us today for another episode of Stand Up and Stand Out. You know you can catch us where all the cool kids hang out that do podcasts on all the major platforms. And if you want to connect with Nikki directly, you can get a hold of me on my personal site, thenikkigreen360.com. There you can check out my website. You can see any of my new books. You can learn more about this podcast and follow us on social. Can't wait to hear from you, and we'll see you on the next episode. Bye.